That's why these medications that are targeting the metabolic system to improve the health and strength of our metabolism are being shown to improve the health and strength of our body systems in general. Because a dysfunctional metabolic system, it's detrimental to those organ systems. So what we're doing is shifting that balance more towards a healthy metabolic profile, which enables our kidney function to be its best, our heart function to be its best, our brain function to be its best, and so on.
This is Fat Science, a podcast dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better. This podcast is for informational purposes only and is not intended to replace professional medical advice.
I'm Dr. Emily Cooper. I've been treating patients with metabolic issues for over 25 years. I'm on a mission to raise awareness about metabolic dysfunction and why diets don't work.
Hi, I'm Andrea Taylor. I've been fat, very fat, chubby, morbidly obese, and done almost every diet ever invented. They all worked until they didn't. I've known Dr. Cooper forever, but when I became her patient and we learned metabolism was the real problem, wow, everything changed, and I've never been healthier.
And I'm Mark Wright. It's time for Fat Science.
Wait, does this podcast make me look fat?
Welcome to Fat Science. I'm Mark Wright, along with Andrea Taylor and Dr. Emily Cooper. It's great to see you two.
Hello.
Hi.
Okay, on the show this week, dementia and metabolism. I think sometimes, Dr. Cooper, we think that the brain is somehow separate from the other organs in our body, in that it, if it functions well, it serves us well. And when it doesn't function well, it's big, big trouble. But I'd like to know more just about how metabolism can impact the brain. And I guess we really should think of it as part of the total system, like heart health and blood pressure and blood sugar and all that good stuff. So why don't you set a baseline in terms of what we should think about when we think about the brain and the brain's health as it relates to metabolism?
Yeah, brain health really does relate to metabolism in so many ways because the brain requires glucose as its primary fuel source, and our metabolism regulates our glucose levels. And so all kinds of metabolic dysfunction can be linked to instability of our blood glucose level, whether it's too low or too high, fluctuating too much, whether our insulin levels that help us handle the glucose are in the right ranges. And so our brain can be really subject to injury if there's something going awry with our glucose and insulin balance.
We think of, glucose as the fuel. I guess it really makes sense because studies have shown that when children don't have a good breakfast, they really have a hard time learning in school, right?
That is true. They show that all the time, that breakfast for kids really helps their academic performance. And they've also shown that these popular low carb diets can really cause problems with blood sugar regulation in terms of like hypoglycemia, which means low blood sugar reactions, and impair cognitive function as well. And that's in children and adults.
Yeah, we all know about that hangry thing.
Yes.
The people you deal with when they're hangry, they are not productive and they're not functioning properly. And you don't get a good communication, good response from anybody. It's not productive.
No, it does affect, cognition, attention, and
driving.
Yep. Complex problem solving, our judgment. So many areas just require steady, consistent, normal range glucose balance.
I was kind of chuckling because my own kids have turned to me and said, Dad, are you hungry? Because you're a little bit off right now.
But it is true. It really is true. Like when you wake up in the morning and you're sort of groggy and sort of, not feeling yourself. And once you sort of get going and have a little something, you do really feel better and you do communicate better and you function better.
So, Dr. Cooper, the way that the brain works, it needs good oxygen flow. It needs a good flow of glucose. What happens when we start to get dementia and the brain just stops functioning the way that it is supposed to?
Well, the most common cause of dementia or type of dementia is Alzheimer's disease. And that risk just increases year after year because of our aging population. And so the unfortunate thing with Alzheimer's is there are some experimental medications that are starting to be looked into that show a lot more promise than the existing treatments. But it's a very difficult condition, and it's thought to partially, at least, result from insufficiency of the brain to actually access glucose and process glucose normally. And there's other forms of dementia also. Multi-infarct dementia is the second most common cause. And that is almost directly related to metabolism because it's affected so much by our cholesterol levels, potential plaque buildup in our arteries, blood pressure regulation, blood glucose regulation. And so, of course, those are all components of the metabolic syndrome. And so multi-infarct dementia is also impacted. But they are finding that cognitive decline with aging, whether related to Alzheimer's or multi-infarct dementia, seems to be linked to problems with energy demand in the brain, glucose access and utilization. So there is definitely a link metabolically.
I remember years and years ago when I first started on Victoza, either I read a study or you were talking about it, or somehow we were talking about how Victoza had an effect on lowering or preventing the onset of Alzheimer's or something like that. I don't know the science. You were better on the science, of course. But I remember that it was something about preventing Alzheimer's. And so I was very excited about that. I, of course, increased my doing the crossword puzzle and my Wordle and all that stuff. But I remember feeling hopeful that maybe I wasn't going to go into the Alzheimer's realm.
Yeah, it's true because they've discovered many, many years ago, more than a decade ago, that liraglutide, which is the Victoza, in animal studies was showing a marked reduction in cognitive decline with aging in the mice. And
all right, so I wasn't a mouse, but I felt hopeful.
Right. And then later they started correlating that a little bit later, not that much later, they started correlating that in human studies where they were seeing a reduction in dementia occurrence in people that were taking liraglutide. And that was, that's just sort of anecdotal. It wasn't double-blind, placebo-controlled studies. So they have progressed now to look at much more formal studies and actual drug trials for Alzheimer's prevention or reduction in symptoms of Alzheimer's with these GLP-1 medications. And a similar thing has been seen with metformin as well, a reduction in dementia risk and also a reduction in that cognitive decline with aging. But again, this formal studies need to be done to actually have these drugs fully recommended as a treatment for that. And what's interesting is certain statin medications also have been shown to reduce the onset of dementia, but yet they get a bad rap. The statin medications, for some reason, people think they and metformin cause dementia, where that's really not the case. It's almost the opposite. So there's a lot of misinformation out there. But I think the whole thing boils down to the fact that, as we said, that dementia is thought to be influenced or potentially totally caused by a problem with glucose utilization, glucose access and utilization by the brain, which can lead to neurodegenerative changes of the brain cells and the onset of dementia. And so anything we do that improves the glucose balance in our body and the glucose access by the brain would really enhance our ability to combat dementia. And so I think it makes total sense that they're starting to see this link with these medications because dementia, especially Alzheimer's, has been nicknamed type 3 diabetes, even though it's not really a medical term, but people refer to it as type 3 diabetes, meaning it's another thing that diabetes can do to us, can present as Alzheimer's disease.
That's interesting, Dr. Cooper, that too much glucose in the bloodstream is bad and too little glucose is bad. Explain, if you would, why that is, because it seems like if you had too much glucose, it'd be a good thing. I've got all this energy that I can use, but it just really has a bad impact on a lot of organs, a lot of part of the body, right?
It really does. Exposure to high glucose levels leads to all kinds of problems because glucose, it almost like crystallizes in our system and it interferes with our nervous system function and our vascular function and our kidney function, our everything that you can think of. But too little glucose is also really detrimental because it means that our body and brain can't access that fuel supply adequately that it needs in order to stay healthy. So a lot of people are walking around with chronic hypoglycemia, meaning low blood sugar reactions. And it's kind of minimized in our healthcare system. And people are told, well, you just have a little bit of low blood sugar, make sure to eat regularly, which is good advice to begin with, to eat all food groups on a regular basis. But it's good to find out why you have this low blood sugar reaction, because sometimes it's due to an imbalance of insulin response, where the insulin response can be exaggerated after eating, right immediately after eating. And that can cause these dips in blood sugar regulation. So that is shown to be a risk factor for future increased risk of dementia and cognitive decline with aging. So it is important. It's not just something to say, oh, it's got a little hypoglycemia. You need to figure out how to get that blood sugar level much more stabilized. So it's good to be aware of symptoms of hypoglycemia, which could be rapid heart rate and palpitations, sweating, feeling jittery, feeling anxious, foggy brain, poor concentration, fatigue, mood swings. So it's that what Andrea was describing as being hangry, but magnified and recurrent throughout the day and repeatedly. So if that's the case, it's good to be evaluated so that you can do some preventive work to prevent future cognitive decline associated with it and to get it straightened out. But too much glucose is also not good because it affects our insulin response, which increases and causes resistance to that hormone insulin, which normally helps our body handle that extra glucose. So the glucose builds up more and more and it overloads our system and it can't actually utilize it correctly. So there's a window of optimal glucose.
So you talked about Victoza earlier. I think both Andrea and I were on Victoza earlier in our treatment regimen for metabolic syndrome. Do we know, Dr. Cooper, why some of these drugs, the GLP-1s, and is Victoza a GLP-1? That's question number one. Do we know why there seems to be kind of a globally positive impact that these drugs have on our system? And you mentioned metformin as well, which is kind of a workhorse, diabetes medication. Break down that, if you would, because I think it's fascinating that these drugs seem to have more benefits than the ones that they were approved for by the FDA.
Yes, and Victoza is, the generic name is liraglutide, is one of the first, not the first, but one of the first GLP-1 medications. And semaglutide is marketed as Ozempic and Wegovy, and that is a newer GLP-1. And even semaglutide is currently in clinical trials for looking at its impact on dementia reduction. And metformin has been around for so many decades. And so,
yeah, what exactly does metformin do? I've always wondered that.
And metformin improves insulin sensitivity in the liver, basically. So it enables our liver to sense that insulin. And in that way, it enables it to, when we are low in fuel, it enables our liver to release stored glycogen, which is that storage form of carbohydrates, to keep our blood sugar balanced. And it's very dependent on that sensitivity to insulin and the other hormone called glucagon that regulates that. So metformin helps. It's almost, I think of it as a pace regulator in our fasting state. It works primarily in our fasting state when we're dependent on that liver to release that storage of glucose because it's between meals or periods of fasting. And so I see it as a pace regulator where it helps release that at a very methodical, even rate, which enables our pancreas to respond with insulin at an even rate. So that's why it has that insulin sensitizing impact, because if we're overloaded with insulin, our receptors start to lose their sensitivity to it and become more numb. But by regulating the pace of the glucose, it regulates the pace that the pancreas is putting the insulin out at, and that enables the sensitivity to return at the tissue level. So that's a little bit, science oriented there. But I think that it's important to think of this as a deeper metabolic underlying issue that people have. And for whatever reason people want to argue, it is increasing in our society. We're seeing higher rates of diabetes, type 2 diabetes, obesity, metabolic syndrome. And so where's that coming from? There is something that's impacting our metabolic system as a whole, our community, our society. And a minority of people in our country don't have metabolic dysfunction at this point. So that's a whole area to tackle, but that's why these medications that are targeting the metabolic system to improve the health and strength of our metabolism are being shown to improve the health and strength of our body systems in general. Because a dysfunctional metabolic system, it's detrimental to those organ systems. So what we're doing is shifting that balance more towards a healthy metabolic profile, which enables our kidney function to be its best, our heart function to be its best, our brain function to be its best, and so on.
If you have type 2 diabetes, do you think that that's something that accelerates it more than any other disease or any other thing that's wrong with you?
Yes, I've seen science reports that are indicating that patients with type 2 diabetes are definitely more prone to dementia. But the better your diabetic control is, then the lower your risk will be. So we have a marker called hemoglobin A1C, and the normal range is below 5.7, and the diabetic range is 6.5 and higher. And so uncontrolled diabetes refers to a hemoglobin A1C of greater than 7. So if you're in that uncontrolled category, your risk goes up for all kinds of things. And so it would be beneficial to people with diabetes to try to aim for the HbA1c below 7. And we're talking about type 2 diabetes. But there is some concern about going too far with diabetes control and experiencing things like hypoglycemia as a result. So if you have patients who are on insulin, for example, taking insulin as a treatment, even if they have just type 2 diabetes, but they require insulin, what we don't want is to overdo the insulin to the point where we're getting low blood sugar reactions, because hypoglycemia also is a really significant contributor to dementia risk.
So, Dr. Cooper, we know that exercise is really good for, all health systems in the body. Is that the same case when it comes to dementia? Do we know?
I think so. I'd have to look at the current research, but I do think that they've definitely linked better cognitive function to regular exercise. And so why that is, I would assume a lot of it has to do with just circulatory system, like helping to bring new blood throughout the body to all different parts of the body, and activating the immune system is something also that the exercise does. So not only does it strengthen the cardiovascular system to deliver more oxygen to body tissues, more nutrients, but it also stimulates our immunity a little bit, and that may be playing a role as well.
We see all kinds of supplements that are focusing on memory and on brain health and all kinds of stuff like that. And we're going to do an episode, I think, about it soon. But do any of those help? Does any of that do anything for you? Or is it just a bunch of, as you would say, marketing, or a bunch of what I would say, just a bunch of junk?
I think the majority is marketing, but there are some nutrients that can be beneficial for dementia prevention or just metabolic function. And those nutrients, though, can be found in foods. And often it's better to get them from foods because supplements come along with a lot of unknown variables and potential risks. So unless you're very clear on which supplement you're taking and why, with a discussion with your healthcare provider, it's really best to try to focus on your nutrition and your lifestyle and focus on a healthy diet, which would contain foods that are rich in the monounsaturated fats. So those are the plant-based fats like olive oil and nuts and avocados, but also the omega-3 oils, which are in fish and
salmon. Very good for
yes,
you.
yes. And some people are vegan, so they get that from plant sources, but the fish is really considered superior in terms of omega-3 oil and EPA oil, which is the really powerful component of the omega-3s. So it's really great to focus on, I think, a diet that is whole foods based, lots of produce, whole grains, beans, legumes, because again, you're trying to keep your glucose level stable and your metabolism healthy. So focusing on a metabolically friendly diet makes the most sense. And when we talked before about exercise, I think that's also one of the reasons why exercise may be beneficial, because metabolically exercise can be beneficial as long as it's fueled well. Sleep is another area, lifestyle wise, to focus on. So rather than taking a lot of supplements, I think you get more power out of focusing on those areas in your life. And stress management is the one that I always tell patients, I have no idea. Tell me if you find out what to do about stress management, because I don't know the answer to that. But if people could go on their own little exploration for what works for them for reducing their overall stress, it really does help improve metabolic function if you have lower stress levels. So, because for example, ghrelin, which is a negative metabolic hormone, it goes up even when we're just annoyed. So if you're really maxed out stress-wise, there goes your ghrelin. And once that goes up, it can influence your blood sugar regulation and it can influence your cholesterol levels. And so stress, sleep, rule out sleep apnea, and just a diet rich in whole foods, mostly coming from plants where you can, but it's fine to eat fish and meats and poultry and everything else, eggs, cheese, whatever you want to eat. But it's just having the majority of your foods that are just coming from the earth, basically.
Well, you always say keep your food as close to what it was invented, like as close to how it came from the ground or how it came from how it started.
Yeah. And a variety of foods too, because remember our microbiome?
Yeah.
Well, this is another area where the microbiome makes a difference in terms of dementia risk too, they're finding. So that's another area that they think potentially the GLP-1 mimetics might be improving microbiome health. And so that might be one mechanism, aside from just the glucose regulation, of how they may be improving our cognitive function and reducing that age-related cognitive decline.
It's so funny. We're always looking for a magic bullet, but getting really good sleep and learning how to control stress are two things that could have just a massive impact on our health, right?
It really can. It can. And it's the hardest thing for our patients. That's probably the area where we see the most trouble for people, staying up really late and too late, not going to bed on time, because people are looking for relaxation time at night by staying up late, but then it doesn't do any good because now you've kind of thrown those hormones off anyway, and you haven't really benefited from that.
And when my wife tells me to take a chill pill, which she does on a regular basis, getting to that place of not getting stressed out and angry and upset. And it's just crazy how little things like that can have a profound impact on our overall health.
It really does. I kind of think that people try things like meditation and other things, but I feel like those are not enough. I feel like we need to look at our own responses to stress and figure out how in the moment to do that kind of self-soothing to reduce the levels in the moment, instead of just having these segregated times when we're just like, now we're de-stressing, because the stress levels are just getting to be really high for so many people right now.
I feel like we're just beginning to understand what causes dementia, Dr. Cooper. I mean, in your opinion, how far have we come, and How far do we have to go when it comes to really understanding what causes these debilitating diseases? And I'm concerned. My grandfather had Alzheimer's, and I think his brother, we called it just, going senile back in the old days.
Right.
But the genetic component is troubling. But how much progress do you think we've made?
I'm not sure. It would be great to speak to an expert in the research field on where we really are, because what I look at as a physician treating patients, I feel frustrated that there aren't better treatments right now for patients. So that tells me that we're not really that far into it, because if we were, wouldn't we have better therapies or preventive strategies? So I do think it's a real big deal, though, that we're looking at the metabolic medications and their role. But if you think about it, now we've known that probably for 10 or 15 years already. So now it's just getting more press now and in clinical trials now, but you can see how long it takes. These observations were made more than a decade ago, and yet we haven't made progress on linking that treatment to people that might need it, or finalizing whether or not it really is effective or it's not effective from these preliminary studies. So everything takes so long in the research world and the medical world. I mean, it's got to be a 20 or 30-year gap in the time when these first observations are made with real science that shows improvement versus placebo. But then you have to go through many more studies and clinical trials. And then by the time it filters into the medical profession, even after that, it's probably almost, gosh, what could it be? It could be 2 decades. So we may be further than I know, because it's not yet reaching, the mechanisms of what's causing it may be understood more than the therapies to treat it. But I think that there should be a lot more focus on this area, because it is increasing now. The Alzheimer's, at least, is increasing. And multi-infarct dementia seems largely preventable, because that really is clearly related to vascular compromise in the brain, which is limiting the glucose delivery, as well as other metabolic factors that limit our ability for our brain to access the glucose. So that seems more linked, easily to treating the underlying metabolic problems right now than the Alzheimer's, because Alzheimer's, which is the one that's more common, unfortunately, it does seem a little bit more mysterious of how to appropriately treat that or prevent it.
Yeah, it's interesting. The brain, for the size of the brain, uses glucose at a massively disproportionate rate, doesn't it, than the rest of our body? It just sucks the glucose out of our body, doesn't it?
It does, especially if you're a person that does a lot of complex problem solving in your job or your life. And I have patients who are both athletes and have jobs where they have to do complex problem solving. And I spend a lot of time talking to them about this competition between their brain and their body for fuel, and why it's so important to fuel adequately both the brain and body when doing the complex tasks, whether physically or mentally. And if not, you can get into that situation where you could potentially be increasing your risk for dementia later in life.
Well, as we start to wrap things up, Andrea, any takeaway from our episode on dementia and metabolism?
I'm just happy that I'm on some sort of drug that'll help prevent something. I mean, so many things can go wrong in your life. I think it's good. Eat healthy, do the right thing, get some exercise, eat a nice plant-based diet as much as you can, I guess. And I don't know, watch everything. I guess that's what we're supposed to do, right?
I think my takeaway, Dr. Cooper, is I am so grateful for the systemic health that I'm enjoying right now. I had an appointment this morning with my asthma doctor, because I take a daily preventive for asthma, and I've had asthma since I was a child. And they took my blood pressure. It was 110/62, and they kind of looked at me, and I'm pretty good, huh? And when you start to treat metabolic syndrome and all the areas that it can manifest itself throughout the body, it leads to such greater health everywhere. And I just feel like, after seeing you for 10 or 11 years now, I feel like my body is dialed in from a health standpoint, that there's nothing going wrong right now. And I'm so grateful for just that I met you and the fact that you're my doctor and that you take such care when it comes to every area of health. I think a lot of times doctors look at their specialty and they try to treat, let's treat your high blood pressure, but they don't look elsewhere. And I just love the fact that if you have metabolic syndrome and you get treated by an expert, you will enjoy better health everywhere. And I'm just super, super grateful for that.
You know what? I would say me too. I think that Dr. Cooper, I think you know how grateful I am, but I would say, you know what? It's sort of like treating metabolic syndrome in the best way possible. It's like a positive domino effect on your body. It's like if you had metabolic syndrome and you start treating it, it's like a domino effect that then, it's like the knee bone's connected to the shin bone connected to it's sort of like all your organs are connected. And for me, at least, and I know for you too, Mark, it's like all my problems were sort of interconnected. And once we started working on one, it was like, that one's connected to this one. This one's connected to this. This one's connected to this one. And then as we sort of dug in deeper, we started to work on all the different things. So I'm hoping that is preventing my Alzheimer's.
Well, we can knock on wood on that one.
I hope so. Let's not jinx anything here.
I don't know. Will I know if it is? I don't know.
Well, we'll let you know, Andrea.
Thank you.
If it becomes an issue. Dr. Cooper, final word from you as we wrap up dementia and metabolism.
I think, nowadays, now that the metabolism and the metabolic dysfunction is getting more attention, I do think that doctors, because if they start to do the treatments for this metabolic dysfunction, they'll notice all those improvements that now the drug companies are kind of spouting out in their own patients. And so it'll change our thinking, I think, in the medical community to where this is going to become much more standard care, I hope, over the next 5 to 10 years, where the metabolic system, health of the metabolism is really a primary focus of a lot of doctors that are in the field of preventive medicine. And so I think we'll start seeing many patients benefit from that over the years to come.
All right. Well, this has been fun. To be continued. And as Andrea said, our next episode is on supplements. You see them everywhere in our social media feeds, supplements that claim to be able to speed up your metabolism, fix your metabolism. We're going to take a deep dive in the next episode of Fat Science. Thanks for joining us.
No diets, no agendas, just science that makes you feel better.
I'm Mark Wright. Thanks for listening to Fat Science with Dr. Emily Cooper, a Work P2P production. New episodes drop every Monday. If you've enjoyed the conversation, subscribe, rate, and review this podcast. This production is for informational purposes only and is not intended to replace professional medical advice. Join us next week for another episode dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better.